At ICTRC, we have conducted randomized clinical trials approved by ethics committee and also overseen and approved by Tata Memorial Hospitals. One arm of this chemotherapy had cancer breast patients who were undergoing chemotherapy, and the other arm had patients with cancer breast who were undergoing chemotherapy as well as the Ayurvedic preparation, the formula. And the results were then enumerated and calculated. These patients were subjected to chemo in one arm, the second arm being chemo plus the Ayurvedic preparation. Many parameters including blood markers, including inflammatory markers, including cancer markers, and including radiological markers like ultrasound, CT scan or PET scan as and when required and as defined in the clinical trial protocol were taken at various time points. So this is one what we say as clinical trial which will help us establish the role of chemotherapy in cancer breast patients who are undergoing chemotherapy in the adjuvant setting. We had a similar clinical trial for patients in head and neck cancers where they were supposed to take radiation after the surgery or take chemoradiation after the surgery. These patients also went through similar protocol where half of the patients were divided into only the radiation or chemoradiation arm and the half of the patients were divided into the radiation and chemoradiation plus a standard Ayurvedic preparation or a formula which was added. The beauty of these products was that the patients were continued on these medications even beyond the treatment period. So we had a defined treatment period till the time these patients were on these Ayurvedic medications. One thing which I found out here was the patients were so much impressed with the results especially in the quality of life of these patients that many of these patients continued to take the same Ayurvedic medicines even after the what we say as protocolized period or the period for which it was given in the protocol was over. So many of them are still continuing the medications on their own expenses because they found it useful. We'll soon have the results and publish them of the short-term and the long-term follow-up data in terms of quality of life and in terms of survival for these patients.